Welcome and hello. Welcome to the Go Plan video library that includes Greenleaf Financial Fitness Series and other financial professional series involved with personal financial wellness. This series, along with other videos, will be posted on our Go Plan YouTube channel, websites, and other social media outlets. My name is Jim Hiles, and as your host, I think it's important to highlight what financial wellness is and how tools like Go Plan 101 can help Americans achieve their goals and wishes. So, what is financial wellness? It is defined as the overall financial health of an individual. What it does for you is probably most important. It helps you increase understanding all things related to money. It can also help decrease stress, help you make better decisions, and perhaps most importantly, keep you on track as things change in the future. What's Go Plan 101? Well, Go Plan 101 combines web technology and educational content with behavioral change solutions, free software, and a huge resource center full of focused responses. Translation? Simple. Go Plan 101 is a cool site that helps people deal with their money issues so they can do what they want to do. And you also have the capability on our site to talk to a coach or go right to the resource. At the end of the day, financial wellness is only as good as the actions taken. So sit back, relax, and enjoy the video.
Good afternoon and welcome to the Greenleaf Financial Fitness Series, 20 minutes to a healthier, wealthier you. Today we are going to be discussing solving the mysteries of Medicare. So as usual, I'd like to introduce some of the people that make these webinars possible. Here we have, in a minute, you'll see who those people are. Jamie Greenleaf. Jamie is a partner and advisor with Cafaro Greenleaf. Jim Hiles, normally with me, not with me today, is First Capital Advisors Group Managing Partner. First Capital, one of the partners that make these webinars happen. I'm Jim D., a financial advisor with Greenleaf Financial. And here with us today, again, is Stephen DeGersdorf. Stephen is a Medicare specialist with Greenleaf Financial. Stephen, welcome.
Thank you, Jim. Good afternoon, everyone. So let's get right into it. Who benefits from Medicare? Medicare is health insurance for three groups of people. Number one, those who are age 65 and older. Number two, people under age 65 who have certain disabilities, who are entitled to Social Security disability or railroad retirement benefits after 24 months. The 24-month Medicare waiting period doesn't apply to people with ALS, also known as Lou Gehrig's disease. People with ALS get Medicare through from the first month they are entitled to the disability benefits. Number three, people of any age who have end-stage renal disease or ESRD, which is permanent kidney failure requiring dialysis or transplant. Jim, the Centers for Medicare and Medicaid Services, or CMS, administers the Medicare program, and signing up happens through the Social Security Administration.
Okay, great. That's a good intro. So good information. I'm not sure everybody knows that. Just want to say we're glad you're back and with us today. So why don't we get into some of the big questions that people have, such as, when do people sign up for Medicare to begin with?
Okay, so when do we sign up for Medicare? There are three different types of enrollment periods for the start of Medicare. The first is the initial enrollment period, which happens when you turn age 65. It incorporates a 7-month period that starts 3 months prior to your birthday month, and 3 months after. It's important to know that if you want coverage to start on your birthday month, your enrollment should be prior to your birthday month. Any time after that will cause a start date after your birthday month. During this entire 7-month initial enrollment, Jim, you don't have any penalties for late entry. The next is the general enrollment. This is for anyone who did not sign up during the initial enrollment. This starts on January 1st of every year and goes through March 31st every year and gives you a start date of July 1st of that year. If your sign up is during the general enrollment, you may incur late enrollment penalties. penalties for starting Part B late will stay with you for your entire time spent on Medicare. Okay, and then finally, Jim, there's what we call special enrollment. If you are working and stay on your benefits at work, you may qualify for a special enrollment period. There are no late enrollment penalties for special enrollments. If doing so, you should check how benefits are paid by your work plan when Part B is not taken. We will look at this closer in a few slides, Jim.
Okay, great. Thanks, Stephen. So hopefully that answers a lot of questions. Now tell us a little bit about how people go about signing up for Medicare.
Okay, there's a couple of different ways there. Enrolling in Medicare is automatic if you are receiving Social Security retirement benefits. In this case, when you are collecting Social Security benefits, you don't have to do anything. Your Medicare card will arrive in the mail approximately 3 months prior to your 65th birthday. Once you have received your ID card, you can apply for additional coverages.
Got it.
Okay, so if you are not collecting Social Security benefits, it's not automatic, and you have to do one of two things. You can call Social Security and set up an appointment, or you can sign up on Medicare.gov approximately 100 days prior to your 65th birthday. This process online eventually forwards you to Social Security Administration, who are responsible for signing us up with Medicare. Of the two, for those comfortable on the computer, the online process has been made to be simple and is a lot faster at about 15 minutes.
Okay, great.
For the entire process. That being said, there are two types of people out there, Jim. Some would like to be rather sit in person. I've done that, and the process does not take that long. So.
Got it, right. So there's a self-serve option for people comfortable with that, and the option of a face-to-face sit-down if a person needs that or feels the need for that, right?
Correct, yeah.
Got it. Okay, good. There's the card, right?
Okay, yep. This is your red, white, and blue ID card. As of April 1st, 2018, Medicare started the process of sending out all new ID cards to recipients of Medicare. They are no longer using Social Security numbers as your ID, which is a good thing. The remainder of your card shows your status with Medicare, showing whether you have just Part A or both Parts A and B, and what your start date is for both parts of Original Medicare.
Got it. Okay, so we hear a lot about the different parts of Medicare. So can you please explain those for us a little bit now?
Yes, so Original Medicare, Parts A and B. Part A covers hospital care. Most of us are paying or have paid into the cost of Part A through Medicare taxes during our working years. Hence, moving forward from age 65, those who worked for a minimum of 40 quarters or 10 years have a premium-free Part A benefit. As mentioned, Part A covers hospitalization. The first 60 days are covered at 100% in a hospital. In skilled nursing, the first 20 days are covered at 100%. Part A of Medicare has a $1,364 deductible for 2019, and this deductible is per occurrence, Jim.
Got it. Okay, now Part B.
Part B of Original Medicare covers medical services outside the hospital. There is a $135.50 monthly cost for 2019. Part B coverage includes doctor visits, lab work, x-rays, ambulance, emergency room, and outpatient surgery. Part B is an 80-20 plan with Medicare paying 80% and the insured paying 20%. And there's a $185 annual deductible, not per occurrence this time. And we will discuss the remedy to this out-of-pocket, Jim, in a few slides.
Okay, great. So also, Stephen, I hear, and I think many of us here talk about whether you're married or single and how much you earn, and that can have an effect on your benefit. How does that work? Is there any truth to that?
Oh, yeah, that's correct, Jim. This chart provides rates for those who have income or joint income falling between the following limits at the time you turn age 65. For example, if you have a joint income between $214,000 and $267,000, the monthly premium for Part B would be $270.90. Note that joint income level is exactly double the amount of the single household income earner, with the same monthly premium of $270.90 per individual. This is an important slide, Jim, for those who are going to continue working after age 65, so that a comparison can be made between staying on your work plan or moving over to Medicare. And one other thing that has come up, just so you know, that CMS can't grasp the income based on current, so they actually use the prior year's income to find for the first year on Medicare, Jim.
Okay, understood. So, Stephen, Medicare doesn't cover everything from a medical cost standpoint. And we talk about this a lot when we're doing financial planning for our clients. There are a lot of costs that aren't covered by Medicare, and people will need to pay for those out of pocket. Can you tell us a little bit about those and how that works?
Yeah, so what you don't get covered with Medicare, dental, vision, prescription drugs, we'll discuss later, are covered under a different part of Medicare. Hearing and help with long-term care. There are insurance coverages out there in the marketplace for dental, vision, and long-term care.
Right, of course. Right. And obviously those can be very expensive items, that list there. So that's why we talk about the cost being over $230,000 or $240,000 per couple out-of-pocket medical expenses that aren't covered by things like Medicare.
That's correct.
So talk about delaying Part B.
So when you delay Part B, when working and covered under an employer plan or a spouse's employer plan, there are no penalties or loss of options. However, there is a scenario in which Medicare is the primary payer when there is another insured involved. For example, when the employee is working for a company with less than 20 employees, Medicare is considered primary. In these cases, when Medicare is primary, it's very important just to note that you have to be sure that the insurance carrier is going to cover you when you're still working over age 65. The best way to do this, Jim, is to just check with the insurance company that's paying the claims.
Got it. Okay. So now we're going to get into Medicare supplements, Medicare Advantage plans, and what those are and why you might want to consider them. So where do you want to start here?
So, where do we go from here? We've discussed Parts A and B of Original Medicare. You've got your employer plan, your Medicare supplement, your Medicare Advantage program. Note that the retirement plans that some are eligible for are not considered credible coverage, Jim, if you're delaying the start of Part B. Therefore, penalties will be added when applying late for Part B.
Got it. Let's talk about what do you have to say about what we have here, retiree or a union plan?
Okay, so with the retirement or a union plan, we want to ask ourselves some questions. Really, what you're doing here is a comparison. Are there copays and deductibles? Does it include a drug plan? If I opt out, can I opt back in later? What is the cost, and does it include dental and vision coverage? This helps you. This helps if you'd like to make a comparison to your other options with Medicare.
Got it. Okay. So can you tell us just briefly what exactly is a Medicare supplement plan?
Okay. So Medicare supplement plans are federally standardized. This helps the consumer shop for a plan because the schedule of benefits will be the same for every insurance company. Therefore, you're shopping for cost, the strength of the insurance carrier. Medicare supplements are offered in all states, Washington, D.C., and there are 10 plans available, A through N, and they're offered at all of those plans are offered in most states.
Okay, so when might someone who's listening now find that a Medicare supplement plan is their best option?
Okay, so most importantly, when you want to budget your medical costs. So what I mean is that the difference between plans A through N in the supplement arena are basically just the out-of-pocket. So it's helpful when determining what your costs would be at claim time. When you travel away from home, Jim, you need to see a doctor. It's very helpful because you can see anybody.
Okay.
If you wish to see any doctor or specialist at home, same thing. The only thing you need to be concerned about is that if the doctor is participating with Medicare. There are no networks of doctors or hospitals. You can see any physician that accepts Medicare. No copays, no deductibles, no referrals. In plans A through N, you'll find plans without copays or deductibles and no referrals. You can be assured to keep it once you have it. And once you've signed up, the insurer cannot terminate your coverage unless you don't pay your premium.
Okay, that all sounds like good stuff. So now give us an idea of when somebody might find that a Medicare Advantage plan might be a better option for them.
Okay, so Medicare Advantage, also referred to as Part C, replaces Part A and B and Part D. You can use as an HMO or PPO, networks of doctors. Usually, one or more plans are available in any given county in your state. Advantage plans include a maximum out of pocket.
Understood. So we've covered parts A, B, C, Medicare Advantage, Medicare Supplement. What about Part D? And we hear a lot about that one. So what can you teach us there?
Okay, so prescription drugs, Part D. Prices vary by county depending on the plan. Cost is also determined by the type of RX you are taking. This is a good time to elaborate, Jim, on the application process. When you go on to apply on Medicare.gov for the Part D RX coverage, the enrollment process asks for some general information, your name, your date of birth, your social security number, address, and then forwards you to pick a pharmacy and then to a page with approximately 15 different plans for you to review. The least expensive and most comprehensive is always the very top on the page. After you've chosen the plan, you are then directed to the online application, which takes about 10 minutes. As you can see, Medicare does a wonderful job with the Part D sign-up, making your life much easier. Just like Part B, late enrollment penalties may be imposed if you sign up late, so best in most cases to purchase a Part D program when turning age 65. Finally, veterans are exempted from the requirement to enroll, but they can do so if they wish. And it's included with some retirement plans.
Okay. Now, we hear a lot of talk over the years about Medicare. I have, and we often hear this funny term, the donut hole, which is one of those terms that some people know what it means, some don't. Can you explain what it actually is and why it might not be funny to some people?
Sure. So 2019 RX gap, that's the other name for the donut hole. You may have heard this referred to as the donut hole. The coverage gaps begin when you and your health plan spend $3,820. The gap goes from $3,821 to $5,100 for 2019. In the gap, you pay 37% of the generic drugs and 25% of the brand name drugs. But 95% of the drug costs that you pay go toward your out-of-pocket. Catastrophic coverage starts again at $5,100. Catastrophic coverage meaning that usually less than 5% of the drug cost is your responsibility.
Okay, that's a lot of good information. So
we covered a lot of ground, and let's just summarize. It's time to put this information to work. We live in a wonderful and a free country, but it's up to us to take responsibility and move forward, particularly on our personal financial wellness. So let's take some action here. Let's go and explore this financial stuff. Take a buddy with you if you need to. Have some fun. Learn a little or learn a lot about what you can do financially. These videos and websites, I hope you enjoy. I think they're great. But if you're like me, sometimes you just want someone to talk it out with. So seek out coaching from our site from professionals who've been vetted to provide you with complimentary initial consultations as being part of the Go Plan 101 experience. If you've not started your planning, or even if you have, use today's video to explore the area of concentration. Make sure you understand how it impacts you. My favorite quote is, life doesn't go in a straight line. You need to stay on top of it. So consider subscribing to our newsletter or our YouTube channel. Please reach out to me if you want more help or have questions. And lastly, thank you for listening. Now, go plan and go attain your financial wellness goals. Jim Hiles signing off for today. Take care.